Hello, everybody, and welcome to today's webinar. Today's webinar is something that we are very passionate about here at NARA, and we're very excited to have all of you with us, and it is Mastering Advocacy, Empowering the Therapy Industry Through Congressional Engagement. My name is Sabrina McCarley, and I am going to kick this off for all of you today. We also have on today's call, we have our NARA president, Kelly Cooney, and we also have Kathleen Dwyer, who is a member of our NARA's Government Affairs Committee. So let's kick it off with some housekeeping. All attendees are on mute. The handouts were provided in the reminder email that you got about an hour ago. If you should have any questions for any of us that are speaking today, we ask that you type those into the Q&A. Any technical issues, if you could put those in the chat box, and Christy's monitoring those. We are recording this as well, and it will be posted for our NARA members on the portal within 24 hours. A little disclaimer about today's webinar. All the information in today's presentation is in good faith, and it's for general information purposes only, and it's accurate as of the date and time of this presentation. So let's kick off with who these people are. Everyone on the screen that you're seeing in their pictures are part of our NARA Government Affairs Committee. We have Jessica Beedry, we have Lisa Chambers, Kathleen Dwyer, who you'll hear from in a little bit, and myself. This next slide, we really love, right? This is all about when you think about advocacy, right? Advocacy truly is at the heart of everything. And this is just little words to help empower us and just give us some, enthusiasm as it relates to advocacy. And you can just see the depth of what that covers. One of the things that NARA is very excited about, the Government Affairs Committee has really created a lot of resources to help you on your advocacy journey. We know that there's a lot of questions, and that's really the premise behind today's webinar. But we also wanted to provide you with kind of those grab and go resources. So on our website, we now are very happy to let everybody know we've got a great advocacy resource center where you're going to be able to provide access to a lot of incredible resources to help you on your advocacy journey. So when we think about advocacy, really, what is advocacy? So if we kind of dust off what an old dictionary is, right, and we look at that, when we look at Webster's dictionary, it really defines advocacy as the act or process of supporting a cause or a proposal, and it's the act or process of advocating. So one of the biggest things that we want everybody to take away from today is that you are the subject matter expert, right? When it comes to talking about your patients, it comes to talking about your profession, it comes to talking about the industry, you are so important, right? It's your voice and you are that subject matter expert. And it's also important that we really acknowledge and we understand that our elected officials, right? They work for us. We're their constituents. Your patients are their constituents. And so it's so important that they're hearing from you as their constituent, really on the issues as it relates to challenges with reimbursement and kind of everything that's going on within the industry. So there's three types of advocacy. The first type is self-advocacy. And this is really speaking for yourself and knowing what's important to you. The second type of advocacy is what's called individual advocacy. And this is when a person or a group of people, an organization, when they focus on the interest of one or a few individuals. And individual advocacy, this can either be formal or informal. And then the third is systems advocacy. And this is where we focus on change at the local, state, and national levels, really to impact change within public policy. So there are 6 principles as it relates to advocacy. Honesty, so it implies a refusal to lie, steal, or deceive in any way. Fairness, the quality or state of being fair. Respect, a relation or reference to a particular thing or situation. Compassion, a sympathetic consciousness of others' distress together with a desire to alleviate it. And integrity, firm adherence to a code of especially moral or artistic values. And 6, self-discipline, correction or regulation of oneself for the sake of improvement. And with that, I'm going to turn it over to Kathleen.
All right, thanks, Sabrina. All right, so let's move on to locating your elected representatives and senators, because you might be thinking to yourself, where do I even start? So what we're going to do next is walk you through these easy steps of how to find where to locate your elected representatives. So here we have a link. You're going to go over to this link and you're going to follow the path. The very first thing they're going to ask you to do is input your zip code. So you can either put in your own zip code to get to your elected officials, or if you'd rather, you can put in the zip code of your healthcare facility or clinic. And once you do that, after clicking the magnifying glass, after you put in your zip code, you're going to find a list of possible members. And so what you're going to need to do next is actually put in your street address, and that will give you your exact, that slide, thank you, that exact representative. So from there, you're basically now, oh, can you go back, Christy? Thanks. From there, this is going to give you the member's name, all of their information. So it's going to give you their office line. It's going to give you both contacts for their website, their office in DC, their office in your state. They're also going to tell you a little bit about the party information. So are they Democratic, Republican? Next slide. All right, so this might be what the website looks like. And of course, from representative to representative, you're going to see a variety here on the websites. But a couple things I want to point out. You're likely going to be able to find their newsletter subscription. So somewhere on their website, there's going to be a contact us or a subscribe button. This is where you're going to be able to get to their newsletter. Another area that you're going, if you could just go back one slide there. Another thing that you can actually find typically on this is their X or Twitter handle. A lot of people in DC use social media to communicate, and you'll be able to get links to their social media platforms, typically from their website. All right, next slide. So when you are requesting to do their newsletter subscription form, it's very simple. You're starting off with your information, clicking submit there. And then you'll be able to be signed up for a weekly, possibly newsletter. They give you little tips and tricks of what they're up to, where they are, if they're in DC, if they're in the home state. It's a great thing to be able to follow your legislators and understand really what their kind of life is like, what their focus is on, and where they're seeking some support from the constituents. All right, next slide. Here you also are going to see that there are other ways to contact your legislators. And for example, perhaps you want to send them an email with some of your thoughts, or perhaps you want to request a meeting with them. So you can select that. Next slide. And we're going to talk a little bit about what it's like to schedule a meeting with them. I think this is a great opportunity for us to talk to our legislators, give them some feedback about what we're experiencing here in healthcare. So let's walk through the steps. It's quite easy. So next slide. So like we said, first step in the process is that you have to formally request a meeting. And most of the legislators have links on their website so that you can just click and easily schedule a meeting with them. As I mentioned earlier, they might be in DC or it might be in your state. So you'll have to specify which office that you want to meet with them in. You can also schedule a meeting for the district that you have business in. As I said earlier, it's a great opportunity for you to have your legislator come out to your clinic. So if you have a facility or a clinic in a major city and you want them to, come over and get a tour, this is your chance to invite them to meet their constituents, otherwise known as your patients. So typically when you are requesting to set up a meeting, they're going to ask you to fill out this form and give some answers to some questions. So let's go through a couple of those to what you should be prepared to speak on. So obviously you need to be prepared with your own personal information, contact information. So you're going to put that into the form. And then some of the other questions that you're going to find here is they're going to ask you why you want to meet. What is this regarding? So you're going to likely have to pick an area of topic. So perhaps it's about healthcare, and perhaps the area of discussion that you want to meet with them on. Another option is to invite them to attend an event. So perhaps your facility is having an open house or some type of event that you think it would be a really good opportunity for them to attend. So again, would be a chance for them to meet and greet and talk with their constituents, again, your patients, about how awesome therapy is. And they'll get a chance to see you firsthand in action, perhaps. So by inviting them to an event, you're going to need to be prepared with the details of that event. When is it? What's the date, the time, the location, and then the purpose of the event. And you might need to also be prepared to talk to them about who else will be there. So anticipating that their needs of that event. Will they need to speak at the event? Are you asking them to do anything specific, or are you just asking them to attend the event? You also should be prepared to identify whether or not media will be present at that event. And one more thing is important is that if they're not able to attend, you might need to be commenting here whether or not a staffer would be invited to attend that event. So as you're getting prepared to invite them to an event, just be prepared with as many details as possible. And certainly if you get the chance to get them to one of your events, I highly recommend that you send them a thank you note after, and giving them the opportunity to be there and present is a great opportunity for us. So I highly recommend giving it a try. And I'll hand it over to Sabrina.
Thank you, Kathleen. So now let's get into the nitty-gritty, right? So let's break this down. There are three branches of government. We've got the legislative branch, the executive branch, and the judicial branch. And what happens is there's oftentimes a lot of confusion. So we're going to help kind of break down some of that confusion and provide some clarification. So let's start with the legislative branch. When we're looking at the legislative branch, there's a lot going on here. This branch is made up of both the House and the Senate, known collectively as Congress. So that's where sometimes we know we get a lot of questions and some confusion, like, well, there's a House and a Senate, and isn't House Congress, and why is it all called Congress? Because together they are Congress. The Constitution does grant Congress the sole authority to enact legislation and declare war, the right to confirm or to reject many presidential appointments, and substantial investigative powers. Now, the House of Representatives is made up of 435 elected members, and that's divided among the 50 states in proportion to the total population of those states. In addition, there are 6 non-voting members, and they represent the District of Columbia, the Commonwealth of Puerto Rico, and 4 other territories of the United States: American Samoa, Guam, the U.S. Virgin Islands, and the Commonwealth of Northern Mariana Islands. Now, the preceding officer of the chamber is the Speaker of the House, and this is elected by the representatives. The Speaker of the House is also third in line of succession to the presidency. Members of the House are elected every 2 years, and they must be 25 years of age. They have to be a U.S. citizen for at least 7 years and a resident of the state. Now, a fun fact here is even though they have to be a resident of the state, they don't necessarily have to be a resident of the district that they represent. The House has several powers that are assigned exclusively to them. And this includes the power to initiate revenue bills, impeach federal officials, and to elect the president in cases of elector tie that we've seen in the past. The Senate is composed of 100 senators, 2 for each state. Senators are elected to 6-year terms by the people of each state. The senators' terms are staggered so that about 1/3 of the Senate is up for re-election every 2 years. And senators must be 30 years of age. They need to be U.S. citizens for at least 9 years and residents of the state that they represent. The Vice President of the United States serves as the President of the Senate and may cast the decisive vote in the event of a tie within the Senate. The Senate has the sole power to confirm those president's appointments that require consent, as well as to provide advice and consent to ratify treaties. There are, however, 2 exceptions to this rule. The House must also approve appointments to the vice presidency in any treaty that involves foreign trade. The Senate also tries impeachment cases for federal officials, referred to it by the House. And in order to pass legislation and send it to the president for his or her signature, both the House and the Senate must pass the same bill with a majority vote. If the president vetoes a bill, they may override his veto by passing the bill again in each chamber with at least 2/3 of every body voting in favor. So a lot going on there. In the executive branch, this consists of the president and his or her advisors in various departments and agencies. The executive branch is vested in the President of the United States, who also acts as the head of state and the commander-in-chief of the armed forces. The president is responsible for implementing and enforcing the laws that are written by Congress, and to that end, appoints the heads of the federal agencies, including the cabinet. The vice president is also part of the executive branch and is ready to assume the presidency should that need arise. The cabinet and independent federal agencies are responsible for that day-to-day enforcement and administration of federal laws. And including members of the armed forces, the executive branch employs more than 4 million Americans. In the judicial branch, this consists of the U.S. Supreme Court and the Federal Judicial Center. Members of the branch are appointed by the president and confirmed by the Senate. And the Supreme Court of the United States is the highest court in the land and the only part of the federal judiciary specifically required by our Constitution. All justices are nominated by the president. They are then confirmed by the Senate, and they hold their offices under life tenure. Federal courts enjoy the sole power to interpret the law, determine constitutionally of the law, and apply it to individual cases. Now, with all of that, you can imagine there is a lot of legislative terms. So we have provided you the link to the glossary from congress.gov, but we also have, and you'll see on the next slide, this is just 2 screenshots of just the glossary of legislative terms. So you can just see there's a lot going on there. And this is one of the resources that you can find on NARA's website in our advocacy resource section. So let's now take a deep dive into the legislative process now that we understand the different branches. So when we talk about the legislative process, we were kind of joking before this call, you know, that old, how a bill becomes a bill, right? And they're sitting on the steps and that old cartoon. There's a lot that you're going to see that goes into this. So let's kind of dig in. When we talk about the legislative process, this begins with an introduction bill to Congress. A bill can be written by anyone. However, it's important to note that only members of Congress can introduce legislation. The initial bill can undergo a multitude of changes during the legislative process, and you're going to see that as we walk through this. Now, this is one of the biggest types of questions that we get. What's the difference between House and Senate and who can co-sponsor? So when we're talking about the House bills, those are that H.R. and the Senate are those S bills. So here's the important piece that oftentimes is very confusing. Senators cannot co-sponsor House bills. They can, however, co-sponsor Senate bills. Representatives cannot co-sponsor Senate bills, but they can co-sponsor House bills. So let's dig a little bit deeper. Once the bill is introduced, it is then referred to the appropriate committee for review. So what does that mean? There are 17 Senate committees with 70 subcommittees. There are 23 House committees with 104 subcommittees. House and Senate committees change in the number and form with each new Congress, and committees oversee a specific policy area, whereas the subcommittees take on more specialized policy areas. So when a bill is first considered in a subcommittee, in that subcommittee, a bill can be accepted, it can be amended, or it can be rejected entirely. If the members of that subcommittee agree to move a bill forward, it is then reported to the full committee, where the process is then repeated again. And throughout the stage of the process, the committees, as well as the subcommittees, what they do is they call hearings to investigate the merits and also the flaws of the bill. And during these hearings, what they do is they invite subject matter experts, advocates, they even invite the opponents to appear before the committee and provide testimony. They can even compel people to appear using subpoena power if that is necessary. If the full committee votes to approve the bill, it is reported to the floor of the House or the Senate, and the majority party leadership decides when to place the bill on the calendar for consideration. If a bill is particularly urgent, then the bill may be considered right away. Other bills may wait for months to be placed on the calendar for consideration or may never actually be scheduled at all. When the bill comes up for consideration, the House, now this is what's interesting, the House has a very structured debate process. So every member who desires to speak only has a few minutes to do so. And the number and kind of amendments are usually limited. Whereas the House, when we're talking about their debate on most bills, it's unlimited. And the senators actually have the ability to speak to issues other than the bill under consideration during their speeches, and any amendment can be introduced. Senators can use this to filibuster bills under consideration, a procedure by which a senator delays a vote on the bill, and by extension, its passage by refusing to stand down. A supermajority of 60 senators can break a filibuster by invoking cloture or the session of debate on the bill and forcing a vote. Once the debate is over, the votes of a simple majority pass the bill. A bill must pass both both houses of Congress before it goes to the president for consideration. So through the Constitution requires that two bills have the exact same wording. It's important to note that this rarely happens. In order to bring the bills into alignment, a conference committee is convened consisting of members from both chambers, and the members of the committee produce a conference report, and this is intended as the final version of that bill. Each chamber then votes again to approve the conference report. And depending where the bill originated, the final text is then enrolled by either the clerk of the House or the secretary of the Senate, and it's presented to the Speaker of the House and the President of the Senate for their signatures. And then the final step is that the bill is then sent over to the President. So a lot going on there. Now, when receiving a bill from Congress, the President has several options here. If the President signs the bill into law, then the bill is then printed in statute at large. If the President decides they are going to veto the bill, then it gets sent back to Congress. So then what happens? Congress may override that veto with a 2/3 vote of each chamber, at which point the bill becomes into law and it's printed. There are two other options that the president may exercise, however. If Congress is in session and the president takes no action within 10 days, well, the bill becomes a law. However, if Congress adjourns before the 10 days are up and the president takes no action, then the bill dies and Congress may not vote to override it. This is called a pocket veto. And if Congress still wants to pass the legislation, they must begin the entire process again. So, what are the committees of the U.S. Congress? In here, in this screenshot, what you'll see is the standing committees of the House and the Senate. So, I know that's kind of small print. So, within the House, we've got Agriculture, Appropriations, Armed Services, Budget, Education and the Workforce, Energy and Commerce, Ethics, Financial Services, Foreign Affairs, Homeland Security, House Administration, Judiciary, Natural Resources, Oversight and Accountability, Rules, Science, Space and Technology, Small Business, Transportation and Infrastructure, Veteran Affairs, and the Ways and Means. For the Senate, their standing committees are Agriculture, if you could go back, Agriculture, Nutrition and Forestry, Appropriations, Armed Services, Banking, Housing and Urban Affairs, Budget, Commerce, Science and Transportation, Energy and Natural Resources, Environmental and Public Works, Finance, Foreign Relations, Health, Education, Labor and Pensions, Homeland Security and Government Affairs, Judiciary, Rules and Administration, Small Business and Entrepreneurship, and Veterans Affairs. That's a lot of standing committees. But we're not done. There are more committees. So we've got the Special Select and other committees. Under the House, you've got the House Permanent Select Committee on Intelligence and the Select Committee on the Strategic Competition between the United States and the Chinese Communist Party. In the Senate, you have Aging. This is a special committee. The Caucus on International Narcotics Control. You have a Select Committee on Ethics. You have an Indian Affairs, and you have a Select Intelligence Committee. There are several joint committees as well. So the Joint Committee on Printing, Taxation, Library, and Economic Committees. And then we've got finally the commissions and caucuses. So under the House, you've got the commission and secretary. and Cooperation in Europe, Congressional Executive Commission on China, Tom Lantos Human Rights Commission, the House Democracy Partnership, and in Senate, we've got the Congressional Oversight Commission. So that's a lot that's going on there. So now that we've talked about how the bill becomes a law and who can introduce the bills and that whole process, then the question becomes, because that is a very long process, how do you track where these bills are in this long process? So we've given you the link here. That congress.gov is amazing. So let's kind of look through in the next couple of slides what happens when you go there. So you're going to be able to find your bills by subject as well as policy area. So let's go to the next slide and we'll show you exactly what that is. So you'll see you've got that drop down menu, you got current Congress, that's what I have it set for. You then in that box right there where the arrow is, you can type in whatever bill you would like. So in our next slide, we have the example of HR 2474. So what you'll see, the bills just come right there and it tells you that it's a bill. So you're going to go ahead and you're going to click on that. When you click on that, this is where you start to get a ton of information. And what you see on those tabs there, you've got different tabs: summaries, text, actions, titles, amendments, who is a co-sponsor. That's something that I know we always are curious about. The committees and any related bills. So in the next slide, what we're going to show you here is when you click on actions, this is where it's super fascinating, right? So you can see in kind of chronological order here, what are the different actions that have been taken and where the bill is. So this is just kind of a cool feature that you can really look and see from different bills that you're interested in with that. And with that, I'm going to turn it over to Kelly.
Thanks, Sabrina. So I think we're going to move from sort of the theory of advocacy into the action of advocacy. And you can go ahead to the next slide, Christy. And really when we put all this theory into action and we move from thinking about to doing, we're going to go meet with people, or we're going to invite people to meet with us. And so before you do that, you want to make sure that you're thinking ahead for long-lasting relationships. And the way that you can do that is make sure that before you meet with someone, either virtually or in person, or before you invite someone to your clinic, that you really know about them. So who is this representative? Who is a senator that you might be connecting with, or the people in their office? Study their biography, know what committees they serve on. You know, Sabrina went through that extensive list of committees. There's a few of those, a select few that really interact with our issues, right? Energy and commerce on the House side, ways and means, finance over on the Senate side. There's a few others as well, that health committee. So knowing whether this person sits on one of those committees and can be really impactful for some of our asks, or whether they are someone that we just need them to sign on as a co-sponsor, that maybe they're not on the committee, but every voice helps when it comes to sponsorship. So being prepared, know what your topics are, and NARA typically has all of that information for you about the topics that are of interest for most of our members. Bring your business cards. I know business cards are a little passé in the rest of the world, but on the Hill, everybody's still handing them out. So bring yours, you'll get theirs. Dress appropriately, business attire. You do want to wear comfortable shoes. You will have to go through metal detectors, so be thoughtful about what you're wearing and what you're bringing. You do want to arrive ahead of time. The Hill, if you're actually in DC, is big. So getting from place to place, you have to be thoughtful about that, as well as making sure that you have time to get through that security. It's kind of like an airport. So if you've never been before, they have a little conveyor belt. You put your things on it. You go through the metal detector. So think about allowing time for that. I think I always tell people to remember that these folks, it's their whole job to listen to people all day. And to assess and evaluate and participate in government. And so it seems scary when you first go in, but remember, these are some of the most practiced communicators in the world, and they're generally very nice people. You might occasionally catch someone that's having a bad day, but generally 99% of the time, people are very open, ready to listen to you and participate in an active dialogue. So don't be afraid. If you're going in a group, you want to make sure that you have somebody that's going to kind of lead off, right? Just like if you're doing any other sort of presentation like this, you've got your agenda, you know what you want to get accomplished, who's going to talk about what. The more that you can be organized, be respectful of their time, the better. Being polite, of course, and courteous. You might feel passionate about something, and passion is okay. But I like to consider when I'm doing some of these visits, I'm a diplomat on behalf of my industry. And so if you think of yourself that way, you need to be diplomatic in your approach. Know the bill name, number, sponsors and co-sponsors if you can. So if you've looked at that website that Sabrina just shared, they may ask you if they're a Republican, who on the Democrat side is supporting this bill. Who was the initial sponsor of this bill? Because then they can speak to that office and maybe get on board. So they'll want to know, does it have, if you come in and say there's 83 sponsors and it's really bipartisan, that's going to help you, right? They want to see things that are going to go somewhere. If there's 2 sponsors and you need more, it's new. There's 2 sponsors. We'd really love your sponsorship. It's so-and-so's office. That was the initial sponsor of the bill. You can talk to them, and I know they'd be really excited to talk to you about it as well. Be clear and concise. We are providers. They talk to lobbyists all day long in a lot of cases, and we have personal stories to share, and I think it's very powerful. So don't be afraid to bring your stories about their district. They really, really want to hear about their district. So if you had 3 outpatient clinics that you closed in their district because of financial pressures, that's important to share, that there were 52 solid employees that no longer are employed, and there were X amount of patients that are no longer being served because of it. We had an example in one of our Oklahoma areas where we lost a crew of home health therapists to go drive a logging truck. That resonates, right? There's a personal story about their district. Be attentive to their questions or comments. If you don't know the answer, it's really fine. You can say, I'd love to follow up and get you that information. And if you don't have it, reach out to NARA and we will help you get what they need and get it back to that office. And then just make sure you follow up. Be prepared with the packet to leave if you have, and once again, NARA has resources, or you can email the packet as well. That's a lot of people prefer the email these days, so don't feel like you have to leave a piece of paper. You can send an email in advance, or sometimes it's great to send it in advance so they have a chance to take a peek. One of the things that I found very successful over the years is to offer to be a resource. We are uniquely positioned across the continuum of care as therapy providers. And so we see the impacts of policy change that they may make and how it impacts across multiple practice settings. So offering to be that resource, you are an expert in their community that they can call upon. And check back if you see something coming up that they might need to vote on, and just remind them that you're there and that you'd love to give them your input is great as well. And then make sure you follow up. Leave your business card, do that emailing, ask them what's the best way to get in touch. And we're going to talk about the invitations to your local, having a local presence as well. Some things to not get discouraged about. Politics is a long game. Sometimes we see quick turnaround, but sometimes things take a while. So don't get discouraged if, for example, your elected official isn't able to be in the meeting, or if they're late. You thought you were going to meet with the senator and it's really just a staffer. Those staffers are more educated generally on your particular issue, oftentimes than the member themselves. So don't get discouraged if you're meeting with a staffer or someone different than you thought. Your input's still getting there to the office. They have that direct ear. I will say, don't also be disappointed if the person that you're meeting with looks like they're 18. They sometimes look young, and they are young, but brilliant people. And they're usually in their 20s, many of them, staffers on the Hill. There are many more seasoned staffers as well. So depending on the how seasoned your member is there on the Hill, they may have a mix of different tenure of staffers, but they're very smart. They tend to really understand your issue, and they will have the direct ear of the voting member. Don't expect to stay for an hour with them. You might get 15 minutes. Sometimes you might be meeting in a hallway or the cafeteria. These offices are small. You think like this person is a congresswoman or a congressman, and that they would have this plush, lavish office. Many of them are very small. And so don't expect don't have any expectations of where you're going to meet. I've met in any number of places. But also don't expect that they really know about what you do. I like to establish whether they've had therapy before or have someone in their family that has. If you can lead with that, that's helpful, because you can then tie it back to, I'm sure when you went for PT for your shoulder, that you probably saw a physical therapist and a physical therapist assistant. You may not have even known the difference, those types of things. And definitely advocacy is a journey. It's not a one-time thing. So just consider building those relationships. Okay, next slide. So you want to capture the moment. Do not be embarrassed to ask for a picture. Everyone does. So and don't feel like it's just good for you. It's good for them, right? You're a voting member, or your company is a constituent. You employ people that vote in their district. They love publicity too. So share the picture, express your appreciation for the meeting. You can tag the person you met with, even if it wasn't the voting member themselves. Definitely, we love it if you tag NARA as well, and we can highlight your visits. And we have Twitter and LinkedIn presences listed here. So definitely capture that moment. Next slide. At home. So I had the pleasure of participating in a recent visit with members from an office, Legacy Healthcare, invited us to join a visit where they had some staffers visiting one of their clinics in Tennessee. And I will tell you, it was amazing for the staffers. It was amazing. I loved being there representing NARA. But what I came away with even more was how amazing it was for the staff there at the facility to get to participate in advocacy and see the work that their company was doing on their behalf. And I had many comments from the staff as we left saying, I just had no idea of all the work that Legacy was doing on our behalf, and the participation with NARA and what you all were doing on our behalf. So there's a lot of wins here if you can make this happen. I have a funny picture from a few years ago of Scott Peters, who's my congressman, sitting in a little bitty chair in one of our pediatric clinics. He's a very tall man. His staff loved it. He loved it. So you can get them an opportunity to have a great photo op. So invite them in. Use their website. You can establish a relationship with their local office. Attend in person or their virtual town hall. So we talked before about how to get on the mailing list. If you're on the mailing list and you start getting their emails, you'll see they'll announce a town hall. You can show up and ask a question. Susan Davis, who was my congresswoman before, she used to every year attend the 4th of July event in my neighborhood. And so she and I would always connect at that 4th of July event. And I'd see her in DC as well sometimes, but I got a lot more accomplished at the 4th of July event where we were tasting pie than in her office in DC. So take advantage of those opportunities to organically meet with people in the community. Follow them on social media. Once again, you'll see where they are. You'll see what they're up to. You'll see what's going on in their offices. Feel free to email. And then when NARA does calls to action, make sure you're participating. Get your friends and family involved. Send out those links and have other people that live in your neighborhood, in their particular localities, in their districts, support your cause as well. Next slide. All right, so some best practices here in terms of planning a facility visit, and we talked about how effective those can be, but there's some things you want to do to prepare for that. So you want to decide on where you want to have that meeting. So of course, you want to think about, I'm going to bring either the congressperson themselves, the senator themselves, or their staff into one of my communities. Of course, you want to pick a good one, the one that you're really proud of. Not that they're all not wonderful, but you want to make sure that you have a staff that's going to be able to articulate the message with you, that you have a good, if it's a senior living or hospital or some other kind of partner, that you have also a great partner that's going to stand next to you. Your partner is going to love it too. They get the opportunity to have this exciting visit come into their facility. If it's your own outpatient clinic, you just want to pick one where you know that it's going to show well, and that you're going to be able to articulate your message well. You're going to want to designate a point person to request the facility visit. You may need to give a few options for dates. You could start with your top one, but be aware that they may need to have you be a little more flexible. And they're going to want to know who's going to be there. So, and where they should park and what time, all those things. You want to make sure that that point person is working with the team, the location you're taking them to, and who's going to be leading the facility tour, who's going to take pictures along the way, if we're going to have residents involved, who's getting signed consent forms, who's going to maybe sit in if we're going to have a roundup at the end. We're going to do a facility tour, and then we're going to sit down and have a conversation. Who's going to participate in that? Do we need any food? Those types of things. Make sure that you've got somebody there also that's going to connect with NARA, because we may have particular information that we want to make sure you share with that legislator. Your legislator may sit on one of those really important committees, or we may have already talked to them about something, and you can say, I know you talked to Sabrina or Kelly or Christy or Karina or Nicole about this, or Beth about this 2 weeks ago, and connect the dots, right? So we can give you any particular insights there on things that, or Karina and Nicole may know something about what are their hot button issues? What do they like to talk about? I know I went to an event with a senator, and they really prepped me ahead of time that she is passionate about Alzheimer's. And so we were able to connect on that immediately. Had I not known that, we might not have gotten there so quickly. Make sure you're designated that point person who's going to follow up afterwards, same as those Hill visits, answer any questions, provide additional information. Oftentimes they'll say, can you get me more information on this thing? Say, absolutely. And then send a thank you. Next slide. Okay. So here's some advocacy in action. If you look at that bottom left, you'll see a picture of that visit I just spoke about with the legacy team and in Tennessee. And we had an amazing visit. The facility partner could not have been more supportive and did a great job with the tour. The patients, the therapists, everybody was positioned perfectly along the way. We had some lovely patient stories that were told along the way, some great interactions, and then an ability to sit down at the end and really go through with the staffers what our asks were. And I thought it was a tremendously successful visit. And so highly recommend the opportunity to do that. And once again, as I said, the staff themselves are, the therapy team were actively participating, and also just, I think, felt so supported by their organization by participating. So it was a win-win all around. NARA also has our PAC. And so some of these pictures are from PAC events where we're able to then have a seat at the table with some folks that really sometimes guide our policy, many of these folks. Also, above you can see that's a picture of some of the folks in our coalition. that we belong to that is of other parties that are interested in the rehab space. So APTA, AOTA, ASHA, ACA, Advion, APTQI, and others. So this is just an example of one of the times where we were able to meet as a coalition, because sometimes when you're looking big picture, sometimes we want to send you, who's a constituent, in to talk. Sometimes we want to go in as NARA to talk because we have a bigger voice. And sometimes we need an even bigger voice where we want this whole team coming in and providing the message, representing a whole bunch of providers. But there are different times when each one of those things is more effective. So we want to be targeted. And oftentimes your voice in your district can be much more impactful than me, who doesn't live there, coming in and talking to someone, or even our government affairs team coming in and talking to someone on your behalf. And they want to hear from you. You matter. And you may not think that your voice does, but in many, many cases, they are concerned about what's happening to people in their district, and you're the best one to articulate that. All right, next slide. So these are just some examples of recent PAC events and coalitions that we've become part of. And you can see here that coalition that I spoke about, but also some of the representatives and senators that we have connected with in this last year. And you can see we try to target those PAC events to folks that are on committees that are influential or that have influential positions. And then being part of coalitions, we can go out and speak as providers about why they should help us, right? Why these policies or these pay cuts or these reimbursement changes are impacting us and poor us, right? And we feel passionate about that, but we can't do that. That voice, there's a lot of other people saying, please help me, things are terrible, right? So we really have taken a active approach to also engaging with beneficiary groups, and the CPR Coalition, the Coalition to Preserve Rehabilitation, and the ITEM Coalition are made up of groups that include both providers and beneficiaries. And so through those groups, we can sign on to letters, we can participate in advocacy together, similarly as we do with the Therapy Coalition, but have the amplified voice of beneficiary groups. And that's been an important shift over the last few years of joining with those groups. And we sign on quite a few things with them. And Lisa Chambers was able to represent us at their meeting month before last as well. We also this year joined the Better Medicare Alliance, which is a group that it's actually one of the managed care associations. And this is one of those keep your friends close things. We want to get a better insight into what the struggles that the managed care organizations are having. How can we be a solution? How can we have a seat at the table to share with them sort of what we see across the continuum? So really trying to place NARA at these tables. So encourage each of you as you are thinking about getting involved in advocacy or enhancing the advocacy that you're already doing. Think about the beneficiaries you serve, and are there certain populations where, if you wanted to bring along someone that, has a mother with Alzheimer's to talk about the impact that it's having on your business. If you have a patient that you want to bring along to talk about something that is impacting them that's related to the policy. Those are great things to do as well. All right, next slide. So right now, we have a few bills out there that are potentially impactful for us. There's the Reduce Act, it's a new one, and it would actually eliminate the requirement to have the plan of care and updated plans of care signed. We would have to send them to the physician, but it would not require the signature. So that's an administrative burden change. The Medicare Home Health Accessibility Act as well. From the workforce standpoint, we're looking at telehealth, and that would there's a few telehealth acts in play right now, but what we want to make sure to address is that it makes a permanent solution for rehab providers, because right now we have temporary access. So we want to make sure that we have permanent access. Some other workforce bills, the Physical Therapist Workforce and Patient Access of 2023, that does only apply to PT, but every little bit helps. As well as another PT related bill is the Prevent Interruptions in Physical Therapy Act. Reimbursement, as you all know, has been a big thing for all of us over the last few years. So we've got a few that are out there right now. And once again, not all of these will gain traction. So we go through and we identify, the series of bills that may have potential and that do good things for us, and we keep them on the radar and we try to narrow it down to some that are going to have the most impact. So the Strengthening Medicare for Patients and Providers Act is helpful for some longer term solutions to our fee schedule issues. I'm not going to go through all of these, but some bigger ones are the Empower Act. That's our long-term solution to supervision for outpatient therapy services. There's the Expanded Telehealth Access Act, another telehealth bill that's kind of workforce and reimbursement. Stopping Addiction and Falls for the Elderly Act is another new one that would actually make a referral to physical and occupational therapy a requirement if a patient that participates in an annual or initial Medicare wellness visit with their physician reports a fall. So that one would be great for us if we can get that moving forward. There's a couple of reimbursement acts as well that would hopefully add a little bit of more stability into the fee schedule. So as we head into next month and our Hill visits, you'll be receiving kind of a narrowed funnel of the ones that we want to push forward on, the ones that we're supporting, and the ones that we want to make sure you're aware of. Some offices, you'll bring up a particular bill and they'll say, well, what about this other telehealth bill? And so being able to say, this is why we support this one, because that other one doesn't have any language that would allow therapists to continue, for example. So a lot's going on. As I said, not all of these are going to gain traction. What we look for is which ones of these have been introduced by some of those important committees and how are they moving? How many sponsors do they have? Which ones have the most likelihood to actually go somewhere? Have they been taken to committee? All right, next slide. All right, so I couldn't say this any more strongly. The more that we advocate together towards these things, the more that we tell our stories and that we are the diplomats for our industry to the people that make regulations that impact us. When we are coordinated in our messaging and we speak loudly about what our issues are to the folks that can help us, then we get better outcomes. And so glad to see the number of people on this meeting today. So glad to see people engaged in advocacy. You might have noticed it's something I'm passionate about, as are the people on this meeting. So we are here as a resource. NARA is here as a resource. And next step, I want to talk a little bit about another opportunity to engage in advocacy, which is this conference that's coming up in May. And we really hope to see you there to join us in DC. We have a pre-conference on outcomes and payer negotiations. And then you'll see when I talk about people that make decisions that impact us, this conference is a great time to interact with those people that make those decisions. CMS will be there, representatives, OIG representatives will be there. We have a former House representative coming and sharing, what is it like to be in Congress and what do they need to hear from us? And we also have Alec, who's a former Energy and Commerce staffer, who's going to share his experience with being on that committee and what he needed to hear from you, and many other great sessions as well. And then the opportunity on the 9th to go to the Hill yourself and advocate. And there's nothing like that. And if you haven't been, you got to do it. It's the best. But if you can't come for some reason, don't be afraid to visit the offices in your district. Get to know them. So we hope to see you all there on our website. You can find the registration. And I think Sabrina looks like she might have something to add at the end here.
I do. Thank you, Kelly. We hope that you all were inspired by today's presentation and empowered, and really just embracing the fact that you all are the subject matter experts when it comes to talking about everything that you love to do every day and the patients that you serve. In regards to the Hill visits, this really is our Super Bowl, right? This is where we all get to go together. We prepare you for these visits. We pair you up with these so you will not be alone. But if you are unable to join in DC, we understand that not everybody is able to join us. You are able, though, to participate in the Hill Visit Preparation webinar. And that is going to go into detail on Tuesday, April 30th. It's going to go into detail on, from all those bills that Kelly talked about, what are going to be the bills that we are going to focus on. And from that, you'll be able to have the resources, those takeaways, those leave behinds that Kelly referenced. Those will be available for you so that you can go through the process, that everything that Kathleen talked about scheduling a visit and making those visits impactful at home. So with that, thank you everybody for attending today's webinar.